8 inflammatory foods to avoid for arthritis and joint pain. Do you know the silent enemy causing pain in your joints and muscles? Arthritis is a pretty common medical condition, and it can be a real pain. Literally, it's characterized by things like joint inflammation, swelling, stiffness, and limited range of motion. And guess what? There are over 100 different types of arthritis out there, but we'll focus on the two main ones: osteoarthritis and rheumatoid arthritis. Osteoarthritis, which is the most common type, happens when the cartilage in your joints breaks down over time due to wear and tear or injuries. It's like your body's shock absorbers slowly wearing out. Now, rheumatoid arthritis is a bit different. It's an autoimmune disease, which means your own immune system goes rogue and starts attacking your joints, leading to inflammation. It can even affect other organs in your body. It's a real troublemaker. But wait, there's more. There are other types of arthritis too, like psoriatic arthritis, which tags along with psoriasis, a skin condition characterized by red patches with silvery scales. Gout is another painful one, caused by the buildup of uric acid in your joints, usually hitting the big toe. And trust me, it's not fun. And then there's fibromyalgia, a chronic condition that's known for widespread muscle pain, constant fatigue, and tenderness near the joints. It's like an all-over body ache that never seems to quit. Now here's the thing. While all these different types of arthritis have their own unique set of symptoms and risk factors, they all have something in common. You guessed it. Inflammation is a big player in the game. Inflammation is like the fuel that keeps the fire of arthritis burning. But let's not keep you in suspense any longer. We'll start by talking about the first food that can actually make your joint pain worse. And after that, we'll dig deep into the real cause of inflammation in arthritis. So stay tuned, folks. You're about to get some valuable insights. Number 8. Processed and red meats. A diet high in processed and red meats can exacerbate inflammation. This includes foods such as bacon, sausages, hot dogs, ham, and even cuts of beef, lamb, and pork. The issue with these types of meats is that they contain higher levels of inflammatory compounds known as advanced glycation end products, AGEs, which we've touched upon earlier. Furthermore, these meats often have a high fat content, and the fats in them, particularly the saturated fats, can induce inflammation. Processed meats also often contain preservatives, additives, and other chemicals that can lead to increased inflammation in the body. For instance, nitrates and nitrites, commonly used in processed meats, can lead to oxidative stress and inflammation in the body. In fact, a study published in the American Journal of Clinical Nutrition has linked a high consumption of red and processed meats to biomarkers indicating higher levels of inflammation in the body. For those with arthritis or those looking to reduce inflammation, considering alternatives such as lean poultry, fish rich in omega-3 fatty acids like salmon, mackerel, and trout, or plant-based protein sources like beans, lentils, and tofu can be beneficial. If you find this information valuable, please like, share, and subscribe, and click on notifications to ensure you never miss a video. Number 7. Dairy products. For some individuals, especially those who are lactose intolerant or sensitive to dairy, consuming dairy products can lead to an inflammatory response. Dairy products such as milk, cheese, butter, and yogurt contain a protein called casein. Some studies suggest that casein can lead to inflammation in the gut, especially in those sensitive to it. Moreover, full-fat dairy products are high in saturated fats, which, as we've discussed earlier, can promote inflammation. The link between dairy and inflammation is still a topic of debate among experts. While some studies suggest a strong correlation, others indicate that certain dairy products, like yogurt, might have an anti-inflammatory effect due to their probiotic content. Nevertheless, for those who've noticed an increase in symptoms after dairy consumption, it might be worth exploring dairy-free alternatives, such as almond milk, oat milk, or soy products. These alternatives often come fortified with calcium and vitamin D, ensuring you don't miss out on essential nutrients. Remember, everyone's body is different. What might trigger inflammation in one person might not necessarily have the same effect on someone else. It's always a good idea to consult with a nutritionist or doctor if you suspect certain foods are exacerbating your inflammation or other symptoms. They can provide personalized guidance and might suggest an elimination diet to pinpoint specific foods that could be causing discomfort or inflammation for you. Number 6. Refined carbohydrates. Now let's talk about refined carbohydrates, folks. Have you ever noticed your joints acting up after indulging in a pizza binge, bagels, cookies, donuts, or pasta feast? Well, here's the scoop. Refined carbs, the kind you find in these foods, break down into sugars super quickly, which then leads to a surge in insulin levels. And what happens next? Yup, you guessed it, Inflammation City. It's kind of like what happens when you down a soda. So, what's the solution? Swap out that white bread and pasta for healthier alternatives like whole grain bread and sweet potatoes. And for some folks, skipping gluten might be a good idea, as it can be a potential trigger for inflammation. Number 5. Oils and trans fats. Next on our hit list are oils and trans fats. Vegetable oils, also known as refined seed oils, are some of the main troublemakers when it comes to worsening arthritis symptoms and inflammation. These sneaky oils like corn, sunflower, safflower, and soybean oils are everywhere, in your kitchen and at restaurants. But that's not all. They're also lurking in packaged or processed foods like potato chips, hot dogs, white bread, fried chicken, French fries, and those irresistible salty snacks. Why are they so bad, you ask? Well, it's all about those omega-6 fatty acids in them. When these oils get exposed to heat and light, they tend to oxidize, which basically means they go bad and wreak havoc in your gut lining, joints, and blood vessels, cranking up the inflammation and making chronic pain and diseases worse. And to make matters worse, there are those nasty artificial trans fats, usually hiding behind the label partially hydrogenated oils on food packaging. You'll find these culprits in vegetable shortening, microwave popcorn, margarine, fast food, and non-dairy coffee creamers. To put out the inflammation fire, you might want to switch these bad oils for the good guys like avocado oil, macadamia oil, coconut oil, grass-fed butter, and extra virgin olive oil. Trust us, your joints will thank you for it. But now, let's get to the root of the problem. You see, while we often hear that inflammation is the villain in the arthritis story, there's more to it than meets the eye. The real culprit here is something called fibrin. Ever heard of it? It's an insoluble protein that usually plays a role in wound healing, forming clots, scabs, and scars. Here's the deal. When you get a little scrape or bump, your body sends in the troops, white blood cells, to deal with any potential infection, leading to inflammation and swelling. Then, fibrin steps in to create a sturdy mesh-like web that seals off the injured area and kickstarts the healing process. This mesh is essential for capturing platelets and red blood cells to form a blood clot. Normally, when the injury is all patched up, fibrin breaks down and the inflammation subsides. But in arthritis, fibrin just keeps on accumulating in your blood vessels and around your joints. It piles up, hardens, and forms scar tissue that restricts blood flow and oxygen. That's why the healing process slows down, and you end up with prolonged stiffness and pain. This is also why pain meds become less effective over time. They're not addressing the root cause. And here's the kicker. Excess fibrin doesn't only mess with your joints. It messes with your circulatory system too. It obstructs the delivery of red blood cells where they're needed most, making your heart work harder and increasing your blood pressure. Plus, it ups your risk of heart disease and stroke. Now, before we spill the beans on how to break down fibrin, let's take a look at some other foods that contribute to its accumulation and inflammation. So stick around, folks. We've got more to uncover. Number 4, soda and sugar. Let's dive into the world of soda and sugar. Soda, especially with its sky-high refined sugar content, has been shown to make osteoarthritis even worse. When you sip on that fizzy drink, it sends your blood sugar and insulin levels on a roller coaster ride. And guess what? That ends up causing more inflammation throughout your entire body. And it's not just soda. Sweetened beverages loaded with high fructose corn syrup are in the same naughty category. But here's the double whammy. These sugary drinks are like a 1-2 punch. Not only do they mess with your blood sugar, but they also bring a ton of empty calories to the party. And those extra calories often lead to weight gain, which, you guessed it, makes your arthritis symptoms even worse. So what can you do to battle inflammation? Well, one simple move is to swap out those sugary beverages for unsweetened tea or good old water. It's a small change that can make a big difference by reducing your intake of refined sugars and giving your body a healthier alternative. Number 3, nightshade vegetables. Now let's talk about nightshade vegetables. That's tomatoes, eggplants, potatoes, and peppers for those keeping score at home. If you're dealing with osteoarthritis, rheumatoid arthritis, or other joint issues like gout, you might want to consider giving these nightshades the boot from your diet. Here's the deal. Nightshade veggies contain alkaloids, which have the potential to contribute to the buildup of calcium deposits in your tendons, ligaments, cartilage, and joints. And when calcium starts to accumulate in these areas, you guessed it, inflammation and pain become your not-so-friendly companions. So if you suspect nightshades might be causing you grief, you can experiment with eliminating them from your diet and see if it helps ease your joint discomfort. Remember, everyone's body is different, so it might be worth a try if you're looking for some relief. But hang tight, folks. We've still got more to uncover about arthritis and how to address its root cause. So don't go anywhere just yet. Number 2. Gluten. Next up, let's talk about gluten. For folks with celiac disease or gluten sensitivity, diving into anything containing gluten can set off an immune response that might just lead to joint pain and a host of other not-so-pleasant symptoms. Here's an interesting tidbit. A study published in the Oxford Journal of Rheumatology showed that a whopping 41% of participants with rheumatoid arthritis saw improvements in their symptoms when they switched to a gluten-free diet. That's some pretty compelling evidence right there. So if you suspect gluten might be the culprit behind your joint discomfort, here's what you can do. Try cutting out all gluten-containing foods from your diet for about 2 weeks. During this gluten-free trial, keep a close eye on how your joints feel. Do they get better or worse? After the 2 weeks, slowly reintroduce gluten and pay attention to how your body reacts. Gluten is a protein found in wheat, barley, and rye, so it's present in a lot of grains and products made from them. By paying attention to how your body responds, you can gain valuable insights into whether gluten is playing a role in making your joint pain worse. Number 1. Charbroiled and blackened foods. Now let's tackle number 1 on our list, charbroiled and blackened foods. If you're dealing with arthritis, it might be a good idea to steer clear of high-temperature cooking methods, like broiling, frying, and grilling. Why? Well, when you cook your food at high temperatures like this, it can produce something called advanced glycation end products, or AGs for short. These little troublemakers can amp up inflammation and make your joint pain worse. So it's a good idea to avoid foods like charred grilled meats and those crispy fried potatoes to cut down on your intake of these inflammatory compounds. Opting for gentler cooking methods, like steaming or boiling, might be a better choice if you're trying to keep your arthritis symptoms in check. But we're not done yet, folks. We still have more to reveal about arthritis and the root cause of joint pain. So stick around for the final piece of the puzzle. Now let's dive into the fascinating world of proteolytic enzymes and how they can help us address the root cause of arthritis. Here's the scoop. These enzymes are like little anti-inflammatory powerhouses that are essential for living a pain-free life. Proteolytic enzymes, also known as proteases, are a special type of systemic enzyme that work their magic by breaking down proteins into smaller, more easily digestible units that our bodies can use effectively. One of their primary jobs is to tackle excess fibrin lurking in our circulatory system and connective tissues, including our muscles. By doing this, these enzymes help get rid of fibrin in scar tissue, which, in turn, improves oxygenation and the delivery of nutrient-rich blood to our tissues. This whole process helps clear out metabolic waste that contributes to pain and inflammation. Here's the kicker. While our bodies naturally produce these proteolytic enzymes in the pancreas, their production takes a nosedive after we hit the ripe old age of 27. So it's crucial to get them from our diets or through dietary supplements. Now let's talk about some delicious dietary sources of proteolytic enzymes: pineapple and papaya. Bromelain from pineapple and papain from papaya have shown their effectiveness in reducing pain, swelling, and joint stiffness in folks dealing with arthritis. But hold on, there's more good news. There are other foods that are rich in proteolytic enzymes too. Think kiwi fruit, figs, ginger, asparagus, and fermented foods like sauerkraut, yogurt, kefir, and miso. These foods can be a tasty addition to your diet and offer a wide range of health benefits beyond just fighting inflammation and pain. They can help soothe muscle soreness, speed up wound healing, regulate blood pressure, boost the immune system, and even help fend off viruses. In a nutshell, if you're looking to ease your arthritis pain, it's worth considering adding pineapple and papaya to your menu. However, it's important to keep in mind that relying solely on food might not be enough to significantly boost your enzyme levels and provide the relief you're seeking. So, there you have it, folks. A deep dive into the world of proteolytic enzymes and how they can be your allies in the fight against arthritis. Remember, a balanced approach that includes dietary sources and possibly supplements can be your best bet for long-lasting relief from joint pain nosedive as we age. By the time we hit our 30s and 40s, our enzyme levels start to plummet. This dip can lead to issues like prolonged inflammation, pain, and longer recovery times from injuries. Now you might be wondering, how can we boost our levels of these powerful enzymes? Well, thankfully, there's a solution. You can get these enzymes from certain foods and supplements. Foods rich in proteolytic enzymes include papaya, which contains the enzyme papain, and pineapple, which is loaded with bromelain. Incorporating these fruits into your diet can give you a natural boost of these inflammation-fighting enzymes. In addition to foods, proteolytic enzyme supplements can also be a game changer. These supplements have been found to help reduce pain, swelling, and inflammation associated with arthritis. They work by promoting healthy blood flow, breaking down excess fibrin, and supporting the body's natural healing processes. The beauty of these supplements is that they target the root cause of pain and inflammation, not just the symptoms. So, if you're struggling with joint pain and inflammation, consider giving proteolytic enzyme supplements a shot. Always consult with your healthcare provider before starting any new supplement, especially if you're on medications or have other health concerns. In conclusion, understanding and addressing the root causes of inflammation can go a long way in managing arthritis and joint pain. From eliminating inflammatory foods to boosting our intake of proteolytic enzymes, there's much we can do to live a more pain-free life. Thank you so much for sticking with us through this in-depth look into arthritis and joint pain. If you found this video valuable, please take a moment to like it, share it with someone who might benefit, and if you haven't yet, make sure to subscribe to our channel. Your engagement really helps spread this information to more people. Don't forget to drop a comment below and let us know your thoughts, or if you have any other topics you'd like us to cover in the future. Thanks again for watching, and take care.